So the agitated stage of recovery, it's actually referred to as the agitated/restless stage of recovery, is one of the most challenging stages for families to manage. And it's because the agitation or the restlessness come from within. Typically, it's not always the direct result of external stimuli, but rather internal stimuli as an individual recovers from brain injury. So some of the things that the family can do is, first of all, to understand that the stage is a natural part of the process of recovery from brain injury, and to understand that it's not a conscious reaction or effort on the part of the person when they act out, when they yell, when they can't control their movements. Rather, it's the brain recovering. We encourage families to look at the environment to make sure that the environment is not increasing the agitation. As one responds to their internal agitation, we know that certain things in the environment can exacerbate that agitation. So things like noisy stimuli, maybe bright lights may do it. Sometimes just a TV and low volume in the background can be enough to set someone off. So we typically recommend that we control visitors or limit visitors to 1 or 2 at a time. Perhaps we shut the door to a room to eliminate background noise coming from hallways or other parts of a hospital or a house. We may keep TVs off or at a lower volume. So things like taking a look at the environment to identify what it is that may increase an individual's agitation.
Someone who's agitated after a brain injury is often seen to have exaggerated responses to even very mild, what we would call environmental stimuli. So what does that mean? Talking to someone gently, putting your hand on them, turning on a light, anything that would normally not elicit a very pronounced response may, in this case, elicit an exaggerated generalized response. The person may move their arms and legs quite vigorously, might try to pull away, might try to pull tubes or pull an IV if they've got one in. So just a very exaggerated, agitated response to even minimal stimuli would be typical.
So the agitated state can be a true stage of recovery, or we can see agitation later on in recovery as a result of environmental stimuli. So I think the first thing that we need to do is to work with those involved in an individual's care to determine whether or not the agitation is part of the natural recovery process resulting from the brain injury, or if those involved in the direct care of the individual feel like the agitation is the individual with brain injury's way of telling us that there's things in the environment that are making it difficult for them to go about their daily routine. So it can be part of the natural process, part of the natural recovery process, or it can be someone that may not be able to directly communicate with us that there's things in the environment affecting them's natural response.
When someone's agitated, sometimes it does show some progress because they're reacting to the outside environment. Understand that with brain injury, it's the most narcissistic thing you can do to a person. You've basically taken away who they are and what they thought they were and who they thought they could be. So if they're responding to you in an agitated way, it may be because there's a personal umbrage, there's a certain response of who they think they are, that you're just rubbed the wrong way. So in some ways, you're actually sort of rubbing them in a way to remind them of what they were, who they were, where they were going in life. The problem is with agitation is it scares everybody, including the person. One other problem with agitation is that many patients with brain injury, especially the moderate to severe, they have very little memory of their outbursts, of their agitation. they could get very agitated, and 10 minutes later, they have no memory of that, or no big deal, or they didn't understand what that agitation meant to themselves and to, obviously, the people around them. It can show some improvement. It can show some progress. I'll give you an example. If you're in the stages 1, 2, and 3, there's no agitation. Stage 4, they're massively agitated and confused. And you say, well, that's better, isn't it? It is, because they're moving through these different scales, different levels on the Rancho scale. But in fact, sometimes that's a bad thing. Is it usually temporary? Yes, in most patients it is temporary. And the more comforting, reassuring, understanding you are, you can move them through that in a better way. It is progress, but sometimes it can be a very scary episode and can affect that person's behavior and the family's and friends' responses to that individual's behavior too.